Hey guys, what's up? Welcome back to my channel. It's me, Heather. Pick it down. I haven't danced in a while. What you guys? Get it. And shout out to the dudes that always say, how they get to dance. Yes, just for you guys. So, I want to bring this up of like a cram session of things you need to know with dentures. Because, guys, I am tired of people telling me I'm not wearing my denture. Why'd you do this process? Why'd you put your body through trauma hell to not wear them? I'm telling you, the world now is so much easier with dentures than it ever was. Picture it. Our grandparents, our great-grandparents, our great-grandparents after that. Like, guys, they went through hell with dentures, man. And they had their body and mouth control it and still wore those shits. So there's so much out there you can do. If you have a warranty, you have the dentist one. Now, I just like to remind people, when you do a dentist soft reliner, it's really harsh chemicals. And shout out to the lady that messaged me. Girl, I feel for you, sister, but please keep me posted. She got a soft reliner done at the dentist and had a major allergic reaction and chemical burns. Like, I would say maybe 14 times a year, people message me, show me pictures, and I'm like, oh my God, I feel for you. I still remember that one girl, my first year of doing YouTube, and a girl messaged me, guys, it was blisters all over her, not like mouth sores. I mean like burn blisters all over her mouth. And she kept telling her dentist, it's burning, it's burning. He goes, that's normal. No, her mouth is filled with blisters because of it. You guys gotta understand that if you have a sensitive body, have them do like a tester or something. Like a one spot, because that can always be fixed and redone. Like one spot and test you. Because, man, I feel for you guys, man. You can't wear your dentures for months when that happens. And you're going to have to never use dentist products. Man, I just feel like it's just pictures running in my head right now, what you guys go through. And I do my own work. If I had a warranty, would I let my dentist do it? My dentist, yes. Because my dentist is like flawless. That man needs to be on YouTube. I know he hates the internet. Dr. Bonzi, you're going to have to get over that one day. Because you're magical with your freaking everything. I don't know how you do what you do. But you're iconic. Man, I want you on my channel one day. I love Dr. Bonzi. He's a Jamaican dude, and I love his accent. But he puts on, like, great music from the 90s. Man's got sick taste in music. I listen to No Scrubs while I get my freaking stuff done. It's the greatest thing in the world. But we're going to move past that right now. Sorry, guys. I go down my rabbit hole. If you guys don't know, or if you guys don't know about YouTube Shorts, I do like 4 to 8 videos a day on YouTube Shorts. And I answer everybody's questions. I give people shout outs on there, put their question up, and I answer them. You guys should definitely go on YouTube Shorts if you're not, because I really make videos. Everybody's watching my shorts. Nobody's really watching my videos anymore. So I still make videos to the people that are my video people. I didn't forget you, boo-boo. Still love you. So, we're going to just let you guys know, please always ask your dentist if you have if you're allergic to everything like me. Yeah. It's so annoying how allergic I am to everything now. My autoimmune life, like, totally trashed my freaking body. But ask your dentist to do, like, a tester reliner, like, just one spot, and see how your body reacts if you're nervous about that. Because that's the pictures I always see. And if you guys ever go through stuff, you ever get bad reliners, you ever get anything, if you want to be part of my videos and I give you a shout out and stuff, just send all the information to my email and I'll make the video to help other people, because I always want to bring awareness. I want to bring the truth. I don't tell anybody what to do. I never do. I give people both sides so they can make their own judgment, because I believe that's how everybody can be their best own advocate and do best for themselves if they know the truth. Like Benzodent. Benzodent itself, the product is a good product. It does help and take away pain. But it's got benzocaine in it, which a lot of other products do. And it can be dangerous. And it's happened to quite a few followers of mine. And that's why I always try to let you guys know. Because I didn't know when I first did it. And I started getting symptoms and they said, stop it now. So I threw it out. And I'm just glad it never reached a severe point. I always ask if I'm not sure. You ask, bro. You ask. But when you do Benzodent, it should never be on the sockets. Should never be interfering with your blood of any kind. It should be around the gums where nothing is opened. And you should only be using it for the short period of time, like a few days. It should never be used like 20 times a day, nonstop, every day for the rest of your life. That's excessive. Even for a month, excessive. If it's 3 weeks, excessive. But there is a black label warning on it. I like people know that because nobody reads the damn box. They quickly glance, but they ain't reading it. If not, I wouldn't be the only one making videos about it. So, please be careful what you guys use. Use what you want. I'm not you. I only do what's best for me. You do what's best for you. But I just want to make videos to help people. And I just want to give people the information so they can make their own, instead of saying, oh, I wish I knew that because I wouldn't have, or I would have. You know what I mean? Like, I just want people to know the truth. I'm going to keep it real with you guys. It doesn't matter how fancy a damn denture brush is. First of all, do not use actual denture brushes. Those thick, hard-ass fucking things. Throw them out. They are way too hard for the denture. It will scratch. It's abrasive. Why they made them, I don't know. Polydent, which you guys rarely see me talk great about Polydent. Polydent has a great denture brush. I don't know where it went. It's no longer in Walmart at my store, which makes me very sad because I need a new one. And I can't find it anywhere. I can't. It's so frustrating. But because I have a very deep trough, like, you know, where the gums go and blah, 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 it's deep and thin. I can't even get my pinky in it. So the Dr. B brush won't work. A regular brush will not work. So it's either a toddler brush, which they're not really effective for me. I can't really clean very well with them. But the Polydent one. Polydent. Good job. Very proud of you. So proud of you. When it worked for me, I immediately made a video when that came. Get it if you can find it. Because that thing will get every nook and damn cranny. It's not big and bulky. It's not hard. It's not any of that. If you want to use a toddler brush, you absolutely can, because we don't, all our dentures are not the same size. You will eventually have a thin ridge, but if you're not there, you're not there yet. You can use a toddler brush. Now, you can use ultra soft and soft. Don't go above that. Don't do medium or hard or whatever. Please, when you guys get this done, you have to take your denture out 24 hours after extractions. First 24 hours, they got to stay in because they act as a Band-Aid. They really, really do act as a Band-Aid for an immediate denture. But when you take them out, it's going to hurt like a mother. Take ibuprofen if you're able to. If you're not allergic, take ibuprofen 30 minutes before you want to take those bad babies out. Do not take them out when you're sleeping for the first week. I say this all the time, so I'm probably purple. But they need to stay in, because when you're sleeping at nighttime, it's going to swell. Now those bitches ain't going in. They're not going in at all. And I know people that had to wait a month to 3 months before they can get them back in, which sucks. So for the first week, make sure you sleep with them in. But 4 times a day, you have to take out your denture, salt, warm water, rinse your mouth. Now people are like, oh, I did it with my denture in. I get it if it's to loosen your denture, but it ain't going to clean your sockets, girl. I've had quite a few people say, I'm like, you got to take out the denture. Clean your denture while you're shaking your head, because don't swoosh. Swoosh can loosen the blood clot. And don't use straws for at least 10 days. So, salt, warm water. And people ask me what salt I use. Guys, you can use any salt. I use sea salt because it is better. It is more, purification and clean. It's just great. I've never tried, I use Himalayan salt for cooking, but I've never tried it for socket purposes because I didn't want to be that guinea pig. That time anyway. I'm the guinea pig. But any problem you guys have with your denture the day you get your immediate denture, if it is loose, it's falling out your damn mouth, say you're going to have to redo this because it doesn't fit. And it's too early to do a soft reliner. You have to wait 30 days after extractions. Because when you know what you're talking about, it kind of shocks them a little bit. I'm not going to lie. They're going to be like, yeah, don't let them do that. If they did not do the denture correct, they need to do the denture correct. You might go home with nothing. But it's better to have a denture that fits when it comes back than have one that you can't wear. It's the same thing. You're still not going to be wearing shit anyway. I always tell people before you do this process, make sure you see quite a few dentists. You want somebody with empathy, somebody with care, somebody very knowledgeable, somebody who respects you as a patient and treats you with care as they would treat their own family. And I know that's hard to find. I got very lucky with Dr. Bonzi. He keeps calling me a badass. Well, you just got to get shit done. That's how I look at it. I don't want this shit dragging out. I want to get it done. So just get her done. But this journey, guys, is more mental than physical. The physical part will go away. The pain, all that, it will go away. But mentally, be kind to yourself. And say to yourself, I can do this. I got this. If Heather can do it, girl, so can I. And yes, fellas, you too. Bruh. Get them done. You guys gotta understand you could die from infections. It's not something to mess with. It's not. And I promise you it's gonna be worth it. No good things ever come easy in life. So when you're able to get this process done, realize it's going to take some work. It's going to take work mentally and physically. I have tons of videos to help you and guide you through the whole damn process. I even got motivational ones. I got ones yelling at you to wear your damn denture. Wear it. Also, too, you guys need to know about monkey mouth. I haven't talked about this in a while. Monkey mouth is common. Do not, please don't. Please don't get your denture adjusted because of it. Before our gums shrink and they're floofy and swollen, we put the denture in, we look like a Dr. Seuss character from Whoville. That's normal. As your gums shrink, which is very quickly, guys. So within a month, you're going to look completely different. But as your gums shrink, the denture goes back and up. That will be gone immediately. If you adjust your denture and you take away that means as your gums shrink, the denture is going to go further back, and now you're going to be flat, no upper lip, nothing. It's going to be a mess. So do not over adjust your denture. Patience is key. Patience with yourself, patience with your denture, patience with your mouth. You got to have patience to do this journey. One day at a time. You know, that saying is there for a reason, guys. Don't rush it. Don't do any of that. Do not wear adhesive. Do not do a soft reliner until 30 days after extractions. Because adhesive is a glue. It will rip out all the healthy skin that you have covered. The blood clot can rip out, dislodge, or move your blood clot, and you will be introduced to dry socket, the worst dental pain of your life. Always make sure you look after yourselves. So one of the guys messaged me a couple weeks ago. I don't remember his name off the hat. I've been talking to people all the time. But he was asking me all these questions. I'm like, if you had infections the day you got extractions, they should have gave you an antibiotic. First of all, clindamycin is the best one for mouth. Because that's the type of bacteria that it kills. It's a phenomenal antibiotic. They should have gave it to you. They should have did all that. It was a mess. The dude ended up at dry socket in a couple of places, and he was on the struggle train. And I feel for you guys because, you know, we trust our doctors, our dentists, anybody. We trust them wholeheartedly. And then when it's like they don't look after us, they don't have our back, it makes us feel more alone than when we started. So if people are in the medical field, if you're a doctor or dentist, treat somebody as they were your mom, as they are your siblings, as your wife or husband. That's how you treat somebody. Because how would you want to be treated if you were in their shoes, you know? You guys got to look at it that way. You be your best own advocate. But if you guys have questions, I'll put them in shorts and I'll answer you guys. I don't want to make this video too long. I'll do a couple of parts to speak and keep adding to it so you guys have a easy video access that you could just click instead of searching. I love you guys. I hope you have a blessed, happy, healthy denture day and wear your damn denture. Later, guys.